2.
Hello, I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we are excited to be talking with Dr. Nick Waukee, who is the owner of Walnut Hills Pediatric Dentistry. He's going to just tell us a little bit about what makes his practice unique, answer some questions about pediatric dentistry and when you should bring your child in for their first appointment. And he has some fun props here as well. I also want to mention that if you comment with any questions or just comments about pediatric dentistry, you will be entered for a chance to win this Sonicare toothbrush for kids. So I know my kids would love this and would probably brush their teeth for a lot longer than they do. All right, so Dr. Waukee, you know, as a parent, when do you need to start thinking about taking your kid to the dentist?
Earlier than one might assume. Between 1 and 2 is the recommended age of
Okay.
the AAPD for getting kids in for the first visit.
That seems really little. So what would that first appointment look like for a parent, you know, if you have a 1 or a 2-year-old?
Sure. And I would say it's a little different for everybody, and I think we all bring our own kind of expectations to the process. But 10 years ago, we just celebrated our 10-year anniversary here. We created just a very, very lovable, genuine farm, yard theme that has a little something for everybody. When the kids come in, they're greeted with a slide and some toys and some video games. A lot of kids will spend time there first. Parents will kind of warm up with them there. Every staff person here is well trained to deal with kids, anxiety, the young, the kind of out of control, the calm, the sedate. Everybody is welcome, and we all have our special way of dealing with that. But first visit, no stress. We don't want parents to be stressed. We want you to just keep an open mind and just trust that we know what we're doing. We're going to give you lots of information to try to make it fun and memorable.
That's great. And yeah, you can see the mural back here is so fun, the farmyard theme. And like Dr. Waukee said, there's a slide and there's like a little gumball toy machine and just lots of fun things for kids here. So they will look forward to coming to the dentist for sure. There are pediatric dentists, but then there are also just, normal dentists that I would go to. What makes you unique as a pediatric dentist, and why should a parent, maybe look for that specialty?
Sure. The world's becoming more and more specialized. The medicine we seek out for our kids, pediatricians, is very commonplace, no different than teeth. The training that we have is above and beyond the regular dental school training. There's a few additional years in which we're taught about the psyche of children, family dynamics and risk factors for cavities, things that start much sooner than a lot of us grew up going to the dentist. And comfort level is a big one. We're very comfortable with kids. We're very comfortable with all the unknowns that come with children, and expectations are very low. So we start there and we build something.
That's great. So tell me about these props that you have here. How would this be part of your, maybe first exam with the child?
Yes, these 3 helpers here have taken a lot of abuse over the years, but what they essentially do is just give the kids kind of a bridge to address the teeth without it being their own. There's child-sized brushes, and a lot of the kids that we meet for the first time, this is their starting point.
Sure.
Parents will hold them, the kids will see that it's pretty harmless, they'll brush the teeth, they can count the teeth. Sometimes these take a lot of abuse, and that's okay. We use it as a demonstration for what can happen when you play too hard.
That's great.
Pretty harmless. I would say most kids are pretty accepting. There's been a few that just aren't really into animals, but we have other ways of handling that.
Sure, that's great. Now tell us about, you have a free toddler visit, or is that, kind of like a first-time visit?
Yeah.
And what would someone do? Do they need to fill out a form or just call in?
I think we have little flyers that are floating around town, but even if you mention this, that you saw this or you heard from a friend, we'll honor it. We just know that parents, especially new parents, sometimes get lost in all the chaos. Things like dental insurance, things like just adding them to policies gets kind of forgotten. So for those young kids, if parents just want to get a first visit, first impression, make sure there's no problems in there. We do that as a courtesy for our new parents, younger kids under the age of 3. So.
That's great. And I think, so right here we're standing in a bay, and you have multiple work areas, I guess you would call it. I would imagine if a family has multiple kids, would they be able to kind of schedule them all at the same time? I know as a mom, it's like, oh, I have to schedule dentist appointments, and they're going to be different days, different times.
Yeah, absolutely. That's something we hear a lot of good feedback about too, is parents with multiple kids, busy schedules. A lot of parents living in the car these days. We can accommodate a lot of larger families. We have kind of a real open setting in part of our building, and then we have some privacy rooms as well for those that don't want all the attention and the more open setting. So
yeah, no, I think that is great. Anytime that moms can kind of multitask at once, make one appointment and get 3 things done is definitely important. And then touch on a little bit, if your child needs to have some kind of dental procedure, like a cavity or something, how do you handle that and make sure that it is a stress-free experience?
Good question, because we all bring our different experiences to the table, and I think probably our biggest obstacle has somehow been just so much information, and there's YouTube, and there's so much to learn before you even experience something.
Right.
And everyone's free to do that, but like we teach the staff here, we're going to give you a new experience that you can base future experiences on. We find a lot of parents have had a lot of rough experiences in the past with their own dental care, and that's hard. There are studies that show that kids pick up on that, right?
Yeah.
And so some of our strategy too is just getting parents to understand what we're going to do, how we're going to do it, and it's pretty well received.
Okay.
Training this to the kids.
Yeah. I will also note I see you have TV screens above every bed, and you mentioned, what did you call it?
Yeah, TV sedation is real, electronics are real. Most of you at home probably have witnessed this as well.
Yes.
But if we can get most kids engaged in something
Right. They're
directly above their
distracted.
heads, yeah, it tends to go pretty well.
That's great. Yeah. What other things do you think are just important for parents to kind of think about? I could see maybe a mom thinks, well, when my kid is 2, they don't even have all of their teeth yet, and they're baby teeth. Why do I need to worry about going to the dentist already?
Sure. And to that, I would say probably the best thing you can do for your kid's dental future is just be aware of what yours is and what risk you bring to the table. Unfortunately, some of these things are genetic, but it doesn't have to be something that plagues their childhood and their future as well.
Yeah.
So just education and just getting comfortable in the new environment.
That's great. Well, thank you so much for just taking the time to kind of talk to us about pediatric dentistry. If you have any questions or comments, leave them below, and we will choose a winner for the toothbrush probably on Sunday. So thank you very much.